Today we will be talking about KVP, MAS, and other factors in radiology. KVP and MAS. KVP stands for kilovolt peak, MAS for milliamperes per second. KVP is the amount of voltage that is given across the X-ray tube, and MAS is a current that passes times the exposure time. KVP voltage is directly proportional to the energy of the beam. The more voltage, the higher is the beam's energy. As energy is directed proportionally to the penetrating power of the beam, KVP is proportional to penetrating power of beam, versus MAS has no effect on energy, so no effect on penetrating power whatsoever. Legal considerations, as well as ethics, are one of the most important things that can be seen in the medical profession. These codes of ethics help ensure a high standard of quality in patient care. Therefore, principles and rules have to be applied. It ensures that those within the profession can further educate themselves about the implications of their actions, as well as educating patients about the sort of care they may expect. These considerations set a specific standard of conduct and regulations by which all members of a profession must abide to. In radiology, the American Society of Radiologic Technology, also known as the ASRT, has established a code of ethics which states the various aspects and roles of the imaging professionals in healthcare. These codes include conduct, respect, diversity, technical applications, decision-making, aid in diagnosing, ethical conduct, confidentiality, radiation protection, and education. The purpose of establishing these legal considerations serves the purpose of creating a framework for a systematic examination of beliefs that may lead the technologists to understand personal and professional morality as well as responsibility. Image identification methods are crucial and a must for all types of radiological procedures and imaging. The importance of these types of identifications serve to identify the part of a patient that is being examined. It also helps avoid a mix-up of patients that have been examined, keeps proper legal medical records, radiograph information, anatomic sides, and many other information that could be vital. All radiographs should include a patient's full name, date of birth, hospital code or number, positioning, tube angulation, timing of the film, as well as many miscellaneous information, which are considered to be the most important type of identification methods for an image. Without these types, it would be very difficult to accurately determine what radiological procedure was done, who the patient was, where it was taken, and can even create confusion that could potentially lead to a misdiagnosis of a patient's condition. Considering the patients have diagnostic images taken at a center or a site different than of their primary care physician or specialist, accurate information needs to be on those images for the providers to be able to follow up.